Hi, my name is Nikki McCrae. By now you've probably heard about the bird flu. It's a hot topic, and there's a lot of information out there that might have left you asking important questions. Who will it affect? How will it impact my workplace? How can I keep myself and my fellow employees safe? The key to this, and any other crisis, is to be informed and prepared. This DVD will give you the accurate facts about the threat of a pandemic in the United States and will help you prepare for the possibilities. A pandemic is a global outbreak of disease. Pandemics occur when a new virus appears or emerges in the human population, causes serious illness, and then spreads easily from person to person worldwide. There is not currently a pandemic in the world. However, we are in a pandemic alert period with limited human-to-human spread. Is it likely that a flu pandemic will occur? Many scientists believe that an influenza pandemic will occur in the near future. However, the exact timing and severity cannot be predicted. Influenza pandemics have occurred more commonly than you might think. In fact, there have been 3 flu pandemics in the last century: 1918 to 1919, 1957 to 1958, and 1968 to 1969.
A pandemic just means that there is an influenza virus that infects a large percentage of the global population, but it doesn't mean it's a virulent flu, or it may just be kind of the regular flu, which makes people sick. You're out of the work for a few days, but then you're back on your feet again. The concern has always been that there'll be a particularly virulent strain, or even a deadly strain.
What is the bird flu? A contagious disease found in animals that normally infects only birds, but occasionally infects humans. What is the virus that is causing this strain of bird flu? The current strain is H5N1. The H5N1 virus has caused severe illness in all human patients, including the death of nearly half the people infected. The concern is that the H5N1 virus could change genetically, which would allow it to spread easily from human to human through coughing and sneezing. Human-to-human spread could cause a pandemic. The symptoms have ranged from typical flu-like symptoms, fever, cough, sore throat, and muscle aches, to eye infections, pneumonia, and severe respiratory diseases.
In the last century, the United States has experienced 3 pandemics: the 1918 so-called Spanish flu, the 1957 Asian flu, and the 1968 Hong Kong flu. Now, the 1918 pandemic was the worst outbreak of disease in human history, killing between 50 and 100 million people around the globe. About 500,000 Americans lost their lives. But the pandemics of 1957 and 1968, although like in 1918, half the world became infected, it was a very mild strain of virus, such that only about 1 million people died in each of those pandemics worldwide. And in the United States, in 57, there were about 70,000 deaths, and 68, maybe 34,000 deaths. And so they were much milder. The only reason the seasonal flu doesn't kill all these people or spread across the world every year is because we've been exposed to the flu in the past. So even if we do get it, our body fights it off. The concern is with these new strains out of the animal world, these new strains coming from birds that we don't have any pre-existing immunity to. Those are the ones that can trigger the global pandemic.
No one can predict if the H5N1 bird flu in particular will cause a pandemic. However, being prepared will better equip you for dealing with any potential disaster. Prevention is the key to any emergency situation. During past pandemics, attack rates reached 25 to 35% of the total population. Under the best circumstances, the world could still experience an estimated 2 million to 7.4 million deaths. In an affected community, a pandemic outbreak will last about 6 to 8 weeks. Across the country, multiple waves of illness could occur, with each wave lasting 2 to 3 months.
Most disease outbreaks are kind of restricted to one area, like really all disasters, right? Earthquakes, wars, famines, acts of terror are typically kind of restricted in time and place. We all kind of look on in horror, but it may not affect us. Pandemics are different. Pandemics are worldwide epidemics. So outbreaks that affect the entire global population everywhere at once, coast to coast. So like in Katrina, where people opened their homes and people found safe havens and people sent checks. Unfortunately, with an event like a pandemic, there's really nowhere to go, nowhere to evacuate to.
There would be large surges in the number of people requiring or seeking medical or hospital treatment, temporarily overwhelming health services. High rates of worker absenteeism could also interrupt other essential services, such as law enforcement, transportation, and communications. Because populations will be fully susceptible to a pandemic virus, rates of illness could peak fairly rapidly within a given community. This means that local social and economic disruptions may be temporary. They may, however, be amplified in today's closely interrelated and interdependent systems of trade and commerce. In a severe pandemic, absenteeism attributable to illness, the need to care for ill family members, and fear of infection may reach 40% during the peak weeks of a community outbreak, with lower rates of absenteeism during the weeks before and after the peak. Businesses will play a key role in limiting the negative impact of a pandemic on society by helping to protect the health and safety of their employees. Businesses should plan for how a pandemic will affect its business. Plan for how a pandemic will affect its employees and customers. Develop a plan to respond to a pandemic. Implement temporary procedures. Allocate resources to be used during a pandemic. Communicate with and educate employees. Work with organizations. Help your community. Plan for the impact of a pandemic on your business. Identify a pandemic coordinator or pandemic team to be in charge of preparedness planning. Some things they need to consider include developing a plan for an increase or decrease in demand for your products and/or services, determining potential impact of a pandemic on company business financials, determining potential impact of a pandemic on business-related domestic and international travel. Identify essential employees and essential operations of the company, anticipating how to function without a significant portion of your workforce. Utilize up-to-date, reliable pandemic information from government sources, community public health, and emergency management. Establish an emergency communications plan and revise periodically. This plan includes identifying key contacts, chain of communications, and processes for communicating business and employee status. Implement an exercise drill to test your plan. Plan for the impact on employees and customers. Prepare for employee absences during a pandemic due to personal illness, family member illness, community containment measures and quarantines, school and/or business closures, public transportation closures. Implement guidelines to modify face-to-face contact among employees and between employees and customers. Consider handshaking, seating in meetings, office layout, shared workstations, etc. Evaluate employee access to and availability of healthcare services, mental health services, and social services. Improve access to services if possible. Identify employees with special needs and incorporate the requirements of such persons into your preparedness plan. Adopt practices that encourage sick people to stay home. Encourage employees to practice good health habits. Encourage annual influenza vaccination for employees. Establish policies to be implemented during a pandemic. Establish policies for employee compensation and sick leave absences, including policies on when a previously ill person is no longer infectious and can return to work. Flexible work sites and flexible work hours, preventing influenza spread at the work site, promoting hygiene and cough etiquette, removal of people with influenza symptoms from work site. Employees who have been exposed to pandemic influenza are expected to be ill or become ill at the work site. Restricting travel to affected geographic areas. Evacuating employees working in or near an affected area when an outbreak begins. Guidance for employees returning from affected areas. Setting up procedures for activating and terminating the company's response plan. Allocate resources to protect customers and employees during a pandemic. Provide infection control supplies in all business locations. Hand hygiene products, tissues, and receptacles for their disposal. Enhance communications and IT infrastructures to support employee telecommuting and remote customer access. Ensure availability of medical consultation. Communicate with and educate your employees. Develop and disseminate programs and materials covering pandemic fundamentals, signs and symptoms of influenza, modes of transmission, personal and family protection and response strategies, hand hygiene, coughing and sneezing etiquette, contingency plans. Anticipate employee fear and anxiety, rumors, and misinformation. Ensure that communications are culturally and linguistically appropriate. Give employees information about your pandemic plans. Provide information for the at-home care of ill employees and family members. Develop platforms such as hotlines and dedicated websites for communicating pandemic status and actions to employees in a consistent and timely way. Identify community sources for timely and accurate pandemic information and resources for obtaining countermeasures, such as vaccines and antivirals. Coordinate with external organizations and help your community. Participate in and promote public health efforts in the community. Create a dialogue with local health officials who can supply information about signs of disease outbreaks. Collaborate with insurers, health plans, and healthcare facilities to share your pandemic plans and understand their capabilities and plans. Collaborate with public health agencies and/or emergency responders to participate in their planning processes. Communicate with public health agencies and/or emergency responders about what your business could contribute to the community. Share best practices with other businesses in your community to improve community response efforts. Start now. Here are some tips you can give your employees today that will make a healthier environment. Stop the spread of germs. Illnesses like the flu are caused by viruses that infect the nose, throat, and lungs. They are spread by coughing or sneezing and unclean hands. To help stop the spread of germs, cover your mouth and nose with a tissue when you cough or sneeze. Then throw the tissue away. If you don't have a tissue, cough or sneeze into your upper sleeve, not your hands.
It's important to cover your cough, but most people do it wrong. You should not cover your cough with your hand, because then you are then spraying your hand with infectious droplets, which you can then pass on to others when you touch a doorknob or when you touch a commonly touched surface. So it's important to cover your cough, but you should do it with the crook of your arm. You should cough into your elbow, into your sleeve if you don't have a tissue.
Clean your hands after coughing or sneezing. Wash with soap and warm water. Rub your hands vigorously together and scrub all surfaces. Wash for 15 to 20 seconds. Clean with alcohol-based hand cleaner. Alcohol-based disposable hand wipes or gel sanitizers may be used. You can find them in most supermarkets and drugstores. If using a gel, rub the gel in your hands until they are dry. Avoid touching your eyes, nose, or mouth. Germs are often spread when a person touches something that is contaminated with germs and then touches their eyes, nose, or mouth. Germs can live for a long time. Some can live for 2 hours or more on surfaces like doorknobs, desks, and tables. When you are sick or have flu symptoms, stay home, get plenty of rest, and check with a healthcare provider as needed. Common symptoms of the flu include fever, usually high, headache, extreme tiredness, cough, sore throat, runny or stuffy nose, muscle aches, and nausea, vomiting, and diarrhea.
Everything you needed to know to survive a pandemic you learned in kindergarten kind of things. Cover your nose and mouth when you cough, wash your hands.
For additional information and tips regarding the bird flu in the workplace, please visit the Centers for Disease Control website. I'm Nikki McCrae. Thanks for watching.